Thank you very much, Nicole. Bonsoir. Good evening. Let me start with a picture. This is an ad from Mount Sinai Hospitals in New York, and I know already that Dr. Bell would have specific comments about this. But in our context, the message is very powerful. If a hospital beds are full, then the hospitals and the entire healthcare system have failed patients. A healthcare system that always has hospitals at full capacity is a system that is not coping. It is a system that needs to be transformed. La nécessité de renouveler le système, c'est le message que le Dr. Bell nous a transmis ce soir, pour lequel je le remercie de sa présence ici. Son message est important. Son message est nécessaire. Notre système doit se renouveler puisqu'il n'est pas viable dans sa forme actuelle. So what does a transformed health system look like? And where does an institution like ours fit into this new vision for healthcare? First and foremost, healthcare must function as a single system. Primary care, home care, community and outpatient care, long-term care, and hospital-based acute care must be designed and delivered like a single integrated system. But of all things, silos of all types must cease to exist. But in creating the integrated system, one must be careful not to create new ones. Second, a transformed healthcare system must be truly patient-centered as opposed to provider-centered. This means that the healthcare system follows the patient, not the other way around. Patients are not merely consumers of healthcare, they are resources. The resources who have a wealth of first-hand experience on how to make healthcare work better. Il faut donc que les patients jouent un rôle actif dans la planification, la conception et la prestation des soins de santé. Et je veux mettre un astérix en disant il faut que ça soit fait, il faut que l'écoute soit attentive et non pas seulement pour plaire à la foule. Nous nous sommes occupés d'eux et avons réalisé des choses pour eux. Un système de santé renouvelé travaille avec eux pour concevoir des soins qui fonctionnent. Lastly, a transformed healthcare system must look at the total health of the population. Public Health Agency of Canada described population health as an aim to improve the health of a population by acting upon a broad range of factors that have an influence on their health. It is not enough to simply treat an illness, a disease, or an injury. We must look at protecting the health of our communities and prevent disease. Quel rôle HSN a-t-il dans ce processus de renouvellement du système? Il doit contribuer à éliminer les cloisonnements, promouvoir des modèles de prestation de soins axés sur les patients et adhérer à l'approche de santé de la population. I would tell you that we have already started transforming our systems of care. It started with the hospitals without wall approach to care. When we launch our strategic plan, maybe it's too many pipe. When we launched our strategic plan 3 years ago, we envisioned a hospital that reached out to our communities and to our patients beyond just the bedside. We started with transforming the former Memorial Hospital into an outpatient facility. Today, patients living with chronic disease come to the outpatient center where they receive care that keeps them healthy and out of the hospital. A great example of breaking down the silos can be seen in the rapid response, a joint initiative of HSN and CCAC. With this program, care teams from both organizations develop one care plan for the patients, and that plan follows them home after they have been discharged from the hospital. Un autre exemple, nous avons conclu un partenariat avec les services d'urgence du Grand Sudbury afin que les ambulanciers paramédicaux fassent des visites de suivi à domicile auprès des personnes âgées, fragiles, après leur sortie de l'hôpital. C'est un bel exemple de soins qui accompagnent le patient. HSN took a big step forward when we created our patients and advisory councils in 2011 or 12, whatever Nick mentioned. We now have patients advisors involved in most, if not all, improvement initiatives underway at the hospital, including the Medical Advisory Committee, higher administration echelon selection committees, including the CEO, the Medical Education Committee. Nous commençons à faire de grands progrès en nous penchant sur les facteurs qui ont un effet sur la santé de nos populations. Notre institut de recherche, comme le disait Nicole, se concentre maintenant davantage sur les populations du Nord et autochtones, ainsi que sur les facteurs qui peuvent nuire à la santé. So as you can see, healthcare transformation is already happening at HSN. It just needs to happen more and far more quickly. But HSN cannot lead this. It has to be led by other stakeholders, most likely primary care, with HSN providing help and expertise in the background. I started my address with an image that depicted the current state of our healthcare system. The second picture is very complicated, very, very complicated. I now want to show you a slide that depicts a future state, a system that is connected, interconnected, effective, and patient-centered, where you see that the hospital is in the back. Everything else is in front of the hospital. HSN welcomes the vision for healthcare outlined in the Government of Ontario's Patients First Action Plan. That plan outlines strategic objectives in the areas of healthcare access, connection, information, and patients' protection. It calls for care to be more evidence-based, accessible, and integrated through direct consultation with patients. It also says patients should be given more information, communication, so they can make good choices about their health. Let me suggest the Hospital Without Walls approach to care we've been pursuing. The approach to care that we've been pursuing aligns with all these strategic objectives. Nous avons implanté l'approche hôpital sans mur au moyen de nouveaux modèles de soins que nous avons mis en place, de nouvelles ententes conclues avec nos partenaires, de l'information accrue du public et de nouvelles occasions pour les patients d'avoir leur mot à dire sur la façon dont nous prodiguons les soins. So we are already going down that path, and in the coming years, HSN will accelerate its effort in this direction with its partners. I would be remiss if I did not mention or cite a number of awards that HSN and its members have received last year. U.S. Award for Supply Chain System, given by Global Healthcare Exchange. 2 National Public Relations Award. Mid-Fracture won the Silver Medal of Excellence in the Best Multimedia, and the intranet site, The Hub, won a Silver Medal of Excellence in the Best Electronic and Social Media category. There were 2 awards for advocacy and achievement in organ and tissue donation in Ontario from Trillium Gift of Life. The virtual care unit is this year recipient of the Minister's Medal honoring excellence in health quality. HSN and its affiliate, the Research Institute, became 36 out of 100 in terms of the number of, became the 36 best research hospitals, up 4 places from last year. We received our 4-year accreditation with commendation from Accreditation Canada. And we've received several honorable mention awards in the Reagan Healthcare PR and Marketing 2015. Some physicians receive awards too. Rob Anderson received the Canadian Association for Medical Education Service Merit Award. Betty Ann Paradis, a nurse from the HSN Hemophilia program, received the Anne Erickson Award. Anthony Conti received a Cancer Care Ontario Human Touch Award, and Carole Maillet received the Canadian Association of Psychosocial Oncology Innovation Award. And those only a few, they're only limited time, but I thought that I would mention this to show you, to underline that our team of leaders, employees, physicians, volunteers, patients advisors have the talent, the determination, and the motivation to ensure that HSN is at the forefront of this transformation.